Kenya's constitution provides that every person has the right to the highest attainable standard of health, which includes the right to healthcare services. To this end, the Center for International Health, Education and Biosecurity, Ciheb-Kenya, a Kenyan non-governmental organization, is collaborating with national and county governments and with communities, transforming lives by ensuring access to quality healthcare and fostering innovative solutions to health service delivery.
The Center for International Health, Education and Biosecurity, popularly known as Ciheb-Kenya, is a local non-governmental organization registered in 2020 and formed out of the University of Maryland, Baltimore programs in Kenya.
Ciheb-Kenya's story began in 2004 at the start of the US President's Emergency Plan for AIDS Relief, PEPFAR funding, when University of Maryland, Baltimore, UMB, established its first HIV and TB service delivery programs in Kenya. Over the years, they evolved, identifying innovative solutions to bridge the healthcare divide. Transition to a local organization was one of UMB's strategic goals.
Our strategic plan has phases that started with having U.S. faculty and staff on ground in Kenya leading the program, then having Kenyans leading the UMB program, and finally having Kenyans lead their own programs. Trust and truly human-centered services happen when Kenyan citizens sees their fellow Kenyans leading and managing.
The university's key objectives in its partnership and collaboration with Ciheb-Kenya is to enhance its capacity to be able to address the healthcare challenges within the Kenyan context, and to do this through really building their technical capacity and their research and academic strengths to be able to provide solutions. And this can only come through diversification of funding and accessing funding that can help to implement these programs.
Ciheb-Kenya is implementing public health programs in 12 counties predominantly, strengthening health systems for the provision of quality HIV and TB services, supporting immunization including initial COVID-19 vaccination scale-up, and now integration in health facilities plus routine and catch-up immunization for children and other eligible populations. These programs are PEPFAR CDC funded, including Truck, Connect, Entrench, Pact Imara, and there's a subrecipient of LVCT in the USAID Stawisha Pwani program.
So Ciheb, having offered more than 95% of the clients HIV test and linked more than 97% of this onto treatment, and supporting the same clients to attain viral load suppression. Currently our viral load suppression is more than 97%. So that ensures that the clients that are actually infected continue to live to their optimal potential and they're not spreading the virus. So overall we are contributing to the epidemic control for the counties that we support as well as the country at large.
When I came, it was my clinic day and we went to the clinician and the clinician disclosed about my status. And I've been on ART since 2012. I've been taking my ART here at Riruta Health Center. Kwa sai nafurahia, viral load yangu iko chini na hiyo inamaanisha virusi vyangu vya chini ziko poa na immune system yangu iko poa juu naweza fight hizo virusi hizo zenye ziko ndani ya mwili juu nimekaa for LDL for 5 years kumaanisha virusi zangu ziko chini.
So the DREAMS program is an acronym for Determined, Resilient, Empowered, AIDS-free, mentored and safe. Okay? It's a partnership with the aim of reducing new HIV incidences amongst adolescent girls and young women.
So economic strengthening tries to
reduce the risks of having transactional sex, especially for girls.
Kwa majina naitwa Hulda Koth. Mimi ni secretary wa Hippo Young Women Group. Tulifanya application na Ciheb. Kutoka kuapply kwa Ciheb, tukapata vitu tulikuwa tunatarajia kama chefing dishes, plates, sufurias, mugs na aprons. Na tukapata tenders mbalimbali tangu tuletewe vitu, na tukafaulu kununua bidhaa zingine zenye tulikosa, na mpaka hapo bado tunatarajia kupata tenders zingine. Tumesaidika sana kama wamama wadogo kuboost biashara zetu na kupata mawaidha mbalimbali kutoka Ciheb.
Ciheb-Kenya's vision and mission articulate a focus on achieving excellent health indicators and outcomes in the communities. Through its programs, Ciheb is working with general target markets, that is, adults, adolescent and children, and key populations including men who have sex with men, female sex workers, people who inject drugs, and transgender individuals, addressing the unique needs for each population group.
HGA is wholly affiliated with the University of Manitoba, the way Ciheb-Kenya is affiliated with the University of Maryland. And the University of Manitoba has been working in Kenya with key populations from the early 80s. And so bringing together two organizations have strengths in different areas. Us in terms of Partners for Health and Development in Africa in terms of key populations. I think it was a game changer because we're having two organizations that are collaborating and bringing what I would call comparative advantages to the table. We've been working with scaled up key population program from 2008. There's actually been an interesting journey with the money that is provided by Ciheb-Kenya to our program. Then we're able to start from the community engagement, the demand creation for the services, setting up the services, and remember, because of the stigma discrimination, these services have to be in unique spaces, which are standalone spaces, whereby individuals can come in and disappear into those spaces and nobody will know exactly what is happening. You go to the clinics, you'll actually find all the clinics very, very busy. And these clinics are set up in a way that as you enter the clinics, it tells you it's a safe space for this targeted population.
So in this clinic, for example, when someone comes, you get received by a reception who does not judge you or discriminate you. So you are received. Your information is taken. So from there, they make a file for you. Then you go to the counselor. The counselor you get tested for HIV, and also if you have any psychosocial, you need the psychosocial support, you will be offered by the counselor. Then from there, you go to the clinician. Now the clinician, you explain why you are here now. For example, if you have an STI or if you have any issue, you explain to the clinician. From there, then you will go to the pharmacy. You will be given medication. Then you are free to go. And it's like a safe space. You can relax. There's a Wi-Fi. There's a cup of coffee. You can at least interact with the other MSM or transgender who come. So you feel like you are home.
Sustainability is core to Ciheb-Kenya's strategic direction. Therefore, the Board of Directors and management have put in place sound business systems that assure efficient, effective, and economic use of resources with oversight from the Board of Directors.
Ciheb was registered in 2020 and got initial funding from University of Maryland. By 2020, their funding was to the tune of $5 million. Between the period 2020 and 2021, Ciheb portfolio grew from $5 million to $50 million. That is 1,000% growth. The management was very intentional in making sure that it aligned its business systems its staffing to be able to manage the risk that comes with managing such huge portfolio. The management was also very intentional in making sure that the business systems were rapidly developed to be able to accommodate the increase in portfolio growth.
The role of the Ciheb-Kenya Board of Directors is to ensure that a sound policy framework has been put in place to manage the funds that the organization receives, and that management thereafter reports on a regular basis to the board to ensure that the policies are being implemented and that the finances are being managed in an efficient and effective manner.
Partnerships have been the cornerstone of Ciheb-Kenya's success. The organization is working closely with the Ministry of Health, county governments, donors, other like organizations, and communities affected to achieve these monumental milestones. These collaborations have amplified their impact, delivering healthcare solutions that are greater than the sum of their parts.
We have strengths in service delivery, in building human resource for health, and this is not just capacity building or training and mentorship, which is really our core business, but also we've worked closely with county governments to engage a multidisciplinary team of healthcare providers who are direct service providers, providing the healthcare services in health facilities to Kenyans who require this.
Ciheb-Kenya's programs have touched hundreds of thousands of lives. Their achievements have transformed healthcare for communities.